Hi guys, I have reached Bangalore and as promised, I'm going to show you all that I do here at Ivory Smiles Dental Clinic in HSR layout. We have Dr Amruta and Dr Prahalad, the ones I had talked about in my last video. Today is the second appointment. We are going to do a lot of things, but I will make sure that the doctors tell you all about the stages and the whole process of Invisalign today. So come with me and let's see. So if you have been following my stories, you would have seen this is that very high technology scanner that they use to do a 3D scan of my teeth. One amazing equipment, I must say. And this is Ivory Smiles Dental Clinic for you. Hi guys, thanks a lot for being a part of my Invisalign journey. After I posted a couple of stories, I had a lot of you asking me a lot of questions regarding the whole process, a lot of hows and whys about Invisalign. So I thought it's best to have the doctors with me to answer all your questions and clarify all your doubts. So here I have the doctors with me. I have Dr Amruta, who is the founder of Ivory Smiles Dental Clinic here in Bangalore, where we are sitting right now. She is a gum specialist and also an implantologist. I also have Dr Prahalad Shenava. He is the orthodontist who is doing the treatment for me. He is a platinum provider of Invisalign, which means that he has done a lot of cases across the country and he's an absolute pro at it. So I have definitely made the right choice by choosing these doctors who are doing the treatment for me. Let's ask them a few questions that you guys had written to me in response to my story. So just to pick up a common question, my first question to Dr. Amruta. Tell me, why is it so hard for people to maintain good oral hygiene?
Yeah. So Arpita, we have to understand this, that maintaining oral hygiene goes way beyond just brushing twice or flossing daily. It requires the patient to come down to the doctor for a round of professional cleaning. Why is professional cleaning so important? Because your dentist is the right person to go in between the nooks and corners of your teeth where your brush or your floss cannot reach, right? And it's always advisable you visit your gum specialist every 6 months to get a complete gum assessment. So that way your gums are the foundation of your teeth and that way your gums are healthy. But for some patients, like you in instance, they've got either spaces in their teeth or they've got crowded teeth, and the alignment of the teeth doesn't allow them to keep it completely clean. So you would have noticed that even after a month of cleaning, the patient always comes back saying, hey doc, I think there's still something left out. But it's not that the dentist has left out something, it's just the alignment of the teeth which is not allowing them to keep it completely clean. Like a regular brushing is unable to remove all the plaque or the tartar in between the teeth. So when I see such patients, I always route them to Dr Prahalad, who's my orthodontist, and he's the right person to basically help me in getting the patient's teeth aligned well, so that the teeth are more healthy and the gum status is much better. So so Dr. Prahalad will be able to help you out with understanding.
Arpita, just like how Amruta rightly said, whenever you have crooked teeth, it becomes very difficult for you to keep them clean. Now it makes absolutely logical sense that whenever you have straighter teeth, the area becomes a lot more self-cleansable and a lot more easier to clean, thereby maintaining good oral hygiene.
So basically a good alignment ensures
that you have healthy teeth,
easily
keep them
maintain.
very clean.
Yes,
Yes.
yes.
Okay.
And you can also avoid a lot of problems like decays,
True.
recurrent decays, because if you have well-aligned straight teeth,
Yeah.
food doesn't get stuck in between the teeth,
Yeah.
in layman terms. So
Right.
the chances of you having decays is going to be much lesser.
Correct. So coming to straightening of teeth, I have had a lot of friends who have used the traditional braces. And Invisalign is such a rave these days. What is it all about? Could you tell us?
Well, just like with anything else, Arpita, today Invisalign is available in India. Earlier it wasn't. Today, like every other latest technology that is available in terms of digital scenario, it's the same over here in orthodontics. When I say orthodontics, I just mean straightening teeth using those traditional ugly braces, which a lot of people didn't like, and I'm sure you were probably one
and
of them.
particularly teenagers and adults.
Yeah,
We-
who are
it's an
very
absolute
conscious
no-no
about
for
this.
us,
Yeah.
yeah.
Absolutely.
Yeah.
So these Invisalign clear aligners accomplish the same objective whatever your traditional braces would do, just that they do it without the inconvenience of being ugly, without the inconvenience of being able to not eat anything you like, and all of those. How does this accomplish its goal? It's very simple. It's a series of these clear aligners that you progressively keep changing every 1 to 2 weeks, and they gradually shift your teeth to the ideal positions wherever they are supposed to be.
Just
So
like
that's
like a GPS system.
yeah, kind of like a GPS
Yeah.
system, wherein you navigate it. Your teeth are just as such navigated using these clear aligner trays, which do the talking to your teeth, and they guide them too.
True, true. So guys, you would have seen there is an absolutely long prelude to the beginning of the Invisalign treatment. You would have seen the stories wherein I showed you how I got my 3D scan done. It took about 7 days for the clean check to be done. The doctors had to speak to the Invisalign team, and the mentors were sitting in Singapore and US before they finalized the whole design of the treatment for me. So I would want Dr. Prahalad to talk about the whole process from the beginning to the end, just to give an idea. What is the time frame a patient would look at,
Right.
and how do you start with this?
So Arpita, like how you had gone through, it's very simple. First, when the patient walks in, we first analyze the case depending on what their condition is all about. We assess their malocclusion and the degree of their severity. Accordingly, what we then go and do is we take their pre-treatment records, which include photographs, which include impressions, which are digitally taken, not with those gooey ones like previously taken. So there's a digital scanner that is put to use, and we get a nice 3D scan, which helps us in delivering these aligners by manufacturing them customized just to your teeth. Okay, they are not going to fit anybody else. That's the beauty of this treatment. Now, along with this 3D scan and the pictures, there is also a set of radiographs that are required to assess how your teeth condition are inside your bone. Okay, how your bone health is. And once we've got all of these records taken, we then go ahead and submit it to the Invisalign team with my prescription for your case, as in what is required to be done to be able to achieve a very good result in your case. And that process roughly takes about, say, a week or two for us to have a fully drawn roadmap, so as to say how your teeth are going to be moving right at the end of your entire journey, how they're going to look and how they are going to get there. Stepwise, that plan is going to be done, and that takes quite a bit of time. But once that is done, then we get back to you and then we show it to you. All good. Then we go ahead and approve the plan, wherein your aligners then get manufactured in their facility that is in Mexico, and then they get shipped all the way here.
So the aligners have come all the way from Mexico.
Absolutely.
Yes, they're manufactured in Mexico.
Well, yes, and then rerouted through
to US and then it comes.
they ship out.
Fantastic. I mean, who wouldn't want straight teeth? But is it possible for anybody with a malalignment or anybody with any other issues to get Invisalign done?
Well, Invisalign practically replaces the braces in every case scenario. There may be certain cases where Invisalign may not be effective, but for that, you'll really have to visit your orthodontist, who would be the best judge to gauge if this can work or not.
So Dr. Amruta, you did a lot of checkups before you gave me a green signal for this treatment. So what all did you check and what all do people need to know before they come and meet the orthodontist for a treatment?
So whenever a patient comes to me, we always do something called as a comprehensive checkup. So by comprehensive I mean I look at all their teeth, I look at the condition, the health of all the teeth. For instance, if there is a decay in a tooth, we have to get that filled or root canaled or crowned, whatever. So all the decays will have to be addressed. If there are any gum issues, that has to be addressed, that has to be stabilized. And we do run a couple of x-rays, which the orthodontist will also need. It's called an OPG and a lateral ceph. So we get that done, and then Dr. Prahalad has a look at those patients.
Right.
And only if it's all okay, then only they can go ahead.
Well, it depends on a case-to-case basis, Arpita. So you can't, generalize every case into one. It's biology. It's always variable.
Absolutely.
So you'll have to try and understand that every case is individualistic. So I would definitely reach out to your viewers and say this, that if in case you have encountered any such problems or any such issues, it's always best you go back to your practicing dentist and then get an assessment from them, because they will be the best judge to guide you through.
Like in Arpita's case, we first had to run you through x-rays called bite wings, which checked all your decays. So we found that you had some tiny decays in between your teeth. We had to get them filled, and only after that you got a round of cleaning done. You got your x-rays done, and then Dr. Prahalad had a look at you. So we first have to do a complete checkup, so that we make sure everything is on point, and then Dr. Prahalad has a consultation with the patient.
Now coming to the speed of the treatment. Now I know it's going to take me over a year, but I know that it's not going to be the same for everybody else.
True.
But what if I had gone for the traditional braces? Would it have been faster?
Well, Invisalign, Arpita, works a lot more faster, roughly about 50% faster than your traditional braces.
Wow.
Now, why is it
Twice
so?
as much.
It's just accomplishing a lot of movements that traditionally we couldn't accomplish using braces at one given point. Invisalign, like I said earlier, it's like a GPS system. It's going to pick up 2 points, point A and point B, and then it's going to draw a straight line and then get you straight.
Correct.
So Invisalign is definitely a lot more faster when compared to your traditional braces. But had you gone in for traditional braces, I think I would have given you a good enough time of around 2 years, 2.5 years.
I'm sure Arpita didn't want that.
Absolutely not. And with those metal braces, no way. Okay, now coming to the main objective of having
The
this
elephant in the room.
Yes. So how much is it going to cost?
Well, see, again, Arpita, there's not a straight cut answer for this, but you'll have to try and understand Invisalign is a cutting edge technology. It involves a lot of logistics that come into play, and much more importantly, it depends on the severity of the case. So there's no hard and fast rule that it is going to cost you this much, but yes, on an average, the usual range that Invisalign falls into ranges anywhere from 1.5 lakh going up to 3.5 lakh, depending upon the severity. Usually, most of the cases do fit into this range, but there may be some, spectrum ends that you may not have countered, and in such cases, your orthodontist would probably.
I guess because it's a very customized treatment, it's extremely custom made, custom fit, so hence it's expensive and it has a lot of advantages.
Yes, and as rightly said by Dr. Prahalad, the cutting edge technology that they use, it is absolutely worth it. So guys, thanks to the doctors for sharing your
Thank you for coming to Bangalore.
Very insightful session we had. A lot of questions were answered for sure. I for sure will take you along with me through the whole process, through my journey. So please watch out for my stories, my posts, and one IGTV video where we will compile all these questions and the answers to the questions that you have been asking me in response to my stories. So watch out for the next post.